Hello, everyone, and welcome back to Senior Cat Wellness. If you are a cat parent, you already know our feline friends can be quite mysterious. They love to hide, especially when they're not feeling too well, and unfortunately, that can make it hard to tell when something's truly wrong. But today, we're going to break it all down and give you the top 10 signs that your cat could be sick and when it's time to call the vet. First off, let's start with changes in your cat's appetite and their desire for liquid, for water. One of the very first red flags to look out for is the change in how much your cat is eating or drinking. If your cat is suddenly skipping meals altogether or drinking way more or way less than usual, that could be a sign of an underlying health concern, from kidney disease all the way to diabetes and even dental pain in some cases. That can make eating and drinking uncomfortable. If your cat has not eaten for more than 24 hours, it's certainly time to see the vet. Next up, let's talk about stark weight loss and stark weight gain. Weight changes are often gradual, just like people. Feline's weight will fluctuate a few pounds to the left or to the right, if you will, up and down. So it can be sort of easy to miss, especially just from a visual, quick look over, let's say, sort of a snapshot here or there, especially if your cat has a lot of fur, a long furred cat, long haired cat. But unexplained weight loss that is quite noticeable and over a short period of time could point to a series of issues such as hyperthyroidism, parasites, or even cancer. Sudden weight gain, on the other hand, almost like a bloated appearance, that could indicate fluid buildup or a thyroid problem. Keep an eye on your cat's body condition overall and consider when weigh-ins at home or it could be possible just to get an idea if your cat is losing or gaining weight and it's sort of out of bounds of their normal. So pay close attention visually and on the scales to how much your cat weighs. Next up, let's talk about vomiting and diarrhea. If your cat is throwing up that hairball occasionally from time to time, that's totally normal. If your cat is vomiting frequently and for seemingly no reason, or has persistent diarrhea for seemingly no reason, it's not something to ignore. Dehydration can set in quickly, especially in older felines and kittens, and it could be caused by anything from food intolerance to an infection, or it could be something serious that has to do with your cat's organs. If symptoms, this diarrhea and vomiting, seemingly out of nowhere and not really connected to a root cause, at least a root cause that you can tell, that you can find, call that vet. Next up, let's talk about sort of what we started off with, that hiding away, lethargy, and hiding more than usual. Cats love to take their naps. We've talked about how some cats can sleep well over a dozen hours a day, but if your usually outgoing and playful cat is suddenly withdrawing from you, withdrawing away from the world to some degree, withdrawing from their environment, turning down things they used to enjoy, such as maybe their favorite meal or favorite play toy, and if sleeping is all they do and all they want to do, something's not right here. Sick cats often isolate themselves and they may hide in some strange places. So maybe some traffic areas that your cat has never entertained before. Now they seemingly can't get up from that area. Lethargy, of course, can be a symptom of many things, from infection to pain, but trust your gut on this one. You know your cat's baseline, their baseline personality, and the routine of the day. If something seems off, it probably is. You're probably correct. And that makes it time to see that vet. Now let's talk about grooming. Cats are naturally clean animals. A healthy cat will constantly groom. That's who they are. That's one of the ways that you can tell if something is off. Because cats, if they can control it, if they have a choice in the matter, they will groom frequently. Your cat suddenly stops grooming altogether or begins to overgroom, whether pulling out fur to the point of causing blood on the skin or just these blatant and obvious bald spots and signs of skin damage. This could indicate stress and pain or perhaps a skin condition. Matted and sort of greasy fur and even dandruff. That could be a sign that your cat's not feeling well. It takes a lot of energy to groom. We've all seen how the crazy, almost pretzel-like positions that cats have to turn themselves into to get a full grooming session in. And if your cat is not feeling well, grooming is the very last thing on their mind. So watch out for what they look like. Either way, large chunks of fur missing or fur not being groomed at all. Either a swing in either direction could be a sign that something is wrong and that a vet visit is in order. Next up, let's talk about your cat's breathing. Are they coughing and wheezing? And is it a frequent concern? This could be something very, very serious. Cats don't usually cough unless something is wrong. It could be a heart condition, could be asthma, could be a respiratory infection. Your cat is, if their tongue is out, if they're panting, if they're breathing with an open mouth, that's not common in felines at all, especially if they're struggling to breathe, no matter mouth open or not. Get them to the vet as soon as possible. This is not something you can wait on. This is not something that you can afford to wait 24 to 36 hours to see if it'll clear. If you notice this, and it's, I would say, no more than 20 minutes, to be honest, especially if it's very stark and very obvious and your cat seems to be in great distress. This is an emergency and you need to treat it like one. Get your cat to the vet as soon as possible. Next up, let's talk about bad breath and what about the occasional drooling. We all know that cats don't have the freshest breath in the world from time to time, but if it's really, really foul and your cat is drooling, and this has now become sort of the new normal, this can be a sign of some serious dental disease, infection, or perhaps even a kidney concern. Excessive drooling could be a sign of pain in the mouth. If it's coupled with nausea, it could be a sign also that they have consumed something, ingested something that is rather toxic. Your cat suddenly is just sort of drooling out of nowhere and their breath is quite foul. Once again, it's time to take your cat to the vet as they could be very sick. Next up, let's talk about that litter box. Any changes to the litter box is a big deal. If your cat has always sort of done what they're supposed to do relative to the litter box, they use the litter box, they cover appropriately. But if your cat is not using the litter box, going to the bathroom just anywhere they please in the home, and also if you've noticed visually, are they having issues using the bathroom? Is it a struggle to urinate? Is it a struggle? Just is it a struggle? Are you noticing that they're in pain? Are they having to push and push? Is it anything but comfortable? This could be a sign of a urinary tract infection, a bladder concern. Male cats, especially, a blocked urethra. This is considered a very potentially life-threatening situation. So, if you're noticing your cat's litter box habits have changed, and they're also coupled with just great discomfort or pain that they're just having trouble masking, then it's very, very obvious. If this looks like something that's difficult, using the restroom for your feline should never be difficult. If it looks like pain's involved, here again, treat it like an emergency and get your cat to the vet. Next up, just changes, almost broad brush changes in their behavior. Is your sweet cat now very aggressive, almost perpetually aggressive? Or maybe quite the opposite. Maybe they are, they always loved you and they always loved their cuddle sessions, but now they just can't seem to leave your lap or leave your side. No matter the side of the coin here, if it's a stark change from the normal, this could indicate that your cat's not feeling too well. They could be in pain. They could have an underlying health concern that's something that's bothering them. If you've noticed this behavioral shift and it's very stark, seemingly out of nowhere, but now it's persisted for days or even weeks, take your cat to the vet. Let's see what's going on here. And finally, your cat's nose and your cat's eyes. Look for any discharge, watery eyes, some squinting, maybe some thick mucus from the eyes and the nose. This could be a sign of an upper respiratory problem. Allergies, maybe they've something has been introduced to the home, a cologne or perfume, an air freshener type spray, anything that's just not sitting well with your pet. If your cat's eyes look very dull and very red, or maybe even glassy or glossed over, especially if they're sneezing. Here again, we're talking signs of an upper respiratory problem, as we would say, just a bad cold. So that's why those routine vet checkups are always important to make sure your cat's health is on the up and up. But if your cat's sort of taking a bad turn and they're struggling to breathe and their eyes are constantly watering, especially if it's the mucus buildup is so thick that it's affecting their vision, don't waste time with that. Don't waste time waiting for your cat to recover naturally. Get them the care they need and get them to the vet as soon as possible. And this leads us to the end. So when should you take your cat to the vet, just in general? Now, some things are emergencies and need to be handled immediately, but in general rule, whatever you're noticing, I would say 24 to 36 hours at tops. There are some things, admittedly, that you might be able to wait out just a while, if for no other reason than to make sure you're seeing that what's going on is exactly what's going on, right? It could just be some simple minor one-off, but 24 to 36 hours. If what you noticed in hour one is still happening at hour 36, or not, if it's not if it's gotten worse, certainly, but hour 36, anything after that, if it's not cleared up, take your cat to the vet, because at that point, time is a factor, a major factor, and the quicker the diagnosis, the quicker the treatment, the quicker your cat can get back to 100% health. It's better to be safe than sorry. I've said that forever when it comes to things of this nature. For your own peace of mind, just make sure your cat's okay. If the worst thing you do is to bring them home with a false alarm, hey, that's a good day. To the wonderful audience of Senior Cat Wellness, I realize that any topic of this nature is quite serious and for the most obvious reasons, but the goal here is to always be educational and informative. But as always, I'd love to hear from you. If you have anything to share, anything you'd like to add to the conversation, that comment section, as always, it's all yours. If you found today's content worthy of your support, I'll just frame it like that. Then please give the video a like, share it out, and subscribe to us right here at Senior Cat Wellness. Until next time, we'll talk to you later.